Hello, hello, and welcome back to the podcast. We're so excited to welcome you to the new season with an all-new name. This is Nice Legs with Dr. Kamran. Thank you to the longtime listeners for sticking around. And if you're new here, welcome. We can't wait to share what's in store for this season and what's coming up with new guests and an all-new focus of nice legs. I'm the show's producer, Aimee Bowen, and with me is Dr. Kamran Goudarzi, the host of the show. He's a double board certified surgeon, pioneer in the most advanced technology and treatment when it comes to healthy legs, and the owner of Scarless Vein Care Clinic. Dr. Kamran, it's so great to be back and it's great to see you.
Well, thank you very much, and thanks for all the compliments. I'm not sure I deserve it, but thank you.
So if you're a listener who's been around for a long time, or maybe you're a patient or a colleague of Dr. Kamran's, or maybe even a fellow physician familiar with this podcast, we used to call it the Nice Living with Dr. Kamran podcast. We covered various topics related to healthy living, but we're going to be solely focused on legs now. You know, Dr. Kamran, as we were talking about the relaunch of the show, we were thinking in terms of just how much there is that goes into healthy legs. There's the look, there's the texture, there's the shape. So can you give our listeners a glimpse of what they can expect in some of the upcoming shows?
Absolutely. So there are more and more podcasts out there, and with Nice Living, it was great because we were discussing all kind of health issues. But I noticed, I've spent at least the last 20 years just exclusively on the venous and, vascular and before then both in the arterial and leg issues. But there is not anything out there which would really discuss everything about the legs, whether it's the shape of the leg, whether it is what keeps the legs healthy, how do you manage to keep your legs fit, to the point of if you're playing any sport, how do you avoid injury, all the way down to plantar fasciitis, what kind of shoes to wear and what kind of a stocking to wear. I thought it would be literally wall-to-wall legs. Anything you want to know about the legs, want to stop shopping when it comes to getting knowledge about the leg health. So what I've been so excited about, and you and I talked about it, we like to bring guests in. Obviously, when it comes to the vascular end, I can talk about it, but I'm not an orthopedic doctor, so I'm not a plastic surgeon, all the way to personal trainers who can tell you what you can do to keep your legs healthy, or orthopods who are into a sport medicine who can tell us how can you avoid injury when you're doing sports, to people who understand about shoes and who could explain to us, what kind of shoes would be good for you, whether you're running or jogging or whatever. So I want to pretty much cover every question that one has about your leg health, including dermatology, all the way from the skin to aesthetics. How can you make your legs look prettier? Or how do you maintain the skin of your legs so it stays healthy? So we want to be able to answer all those. And I thought, over time, hopefully for our audience, we could also set up live sessions where you can call in and ask any questions you have to either to myself or our guest. And hopefully you could tell us what kind of guests you'd like us to have by reaching out to us and say, could I have a plastic surgeon next time, or a chiropractor, or a podiatrist, so we can make this all available to you. So I'm very excited about this, and you and I have been talking about this for a long time. I noticed there isn't really much available out there to discuss purely your leg health. And so to be able to provide that, I thought it would be great. And I'm so thankful to you, Aimee. I know we went through, a little bit of latency or hiatus during the COVID, but I'm so glad that you're back, and we are back better than you've ever been. We've got a better sound quality. We've got a better studio, and it's so much easier now to reach out through telemedicine, I call it, but it really is, and to invite guests. We could invite guests from all over the country to get into this conversation.
Absolutely. And I know we'll be bringing some patients into the fold as well to talk about their challenges with leg health, and then how transformative it's been just addressing some of those vascular issues alone, from improved quality of life, activity levels returning, and then, of course, the aesthetic aspects as well. Really looking forward to it.
And the health issues which are associated with venous insufficiency, most people, if they don't think they have visible veins, they don't have venous insufficiency. I was on a trip and I was in Iceland, and the next thing I hear on television that the president has leg swelling, and there was this health scare that was there something wrong with him, and was he going to survive? And come to find out that he had venous insufficiency. Venous insufficiency, for example, is kind of interesting because although it's very common, not everybody gets affected or doesn't deteriorate to the same extent. My argument in his case was, at his age, he's had venous insufficiency, I promise you, all his life. It just became obvious, especially during this term. We all know the last 6 months, he's been crisscrossing the world in his aeroplane. And I'm sure he's not been wearing compression stocking because he didn't know he had venous insufficiency. So although it was been brewing in the background, being in an aeroplane because of a negative pressure, it makes you much more prone for venous insufficiency to deteriorate. So although he was deteriorating at a very slow level, and he probably never would have any issues being in an airplane, standing without compression stocking, all of a sudden, I call it, hell broke loose. At the last valve gave, and all of a sudden both legs swell up. Huge health scare. And they did a very thorough workup, by the way. They checked him out. He did not have a clot in his lungs. They didn't have any clots in his legs. There was no acute clot. They did a blood test. He showed he didn't have it. They checked his heart. His heart pumps very well. They checked his kidneys functioning well. And so in the end, when they look at his legs, they find out, long and behold, he has venous insufficiency, which just got worse because of the amount of time he plays in a plane. Now, that's just my impression because I have a lot of patients who are pilots, they are flight attendants, and the airplane is not always pressurized. And somebody told me if you take a little soda bottle with you into airplane, you'll find out what happens to it. When legs are the same thing, the negative pressure, the cabins are not pressurized till you get really high up there. So if you want your legs to really deteriorate from venous point of view, get in an airplane. And now he's constantly in an airplane. He's standing. So something that's simple. He has all these most amazing physicians around him, and he checks himself every year. But nobody had any idea he had venous insufficiency because it was brewing in the background.
Mm-hmm. Yes. And, Dr. Kamran, hearing you talk about that a little bit more, I think it raises just such a critical spotlight that needs to be on leg health and vascular health in particular. Because, the president has access arguably to the top doctors in the world. And if he's not wearing compression stockings, that means those physicians might not even be aware of how important it is to have those preventative measures in place, especially if people have risk factors and are doing things like frequent flights and things like that. So it sounds like there truly is still a gap there, even among practitioners when it comes to leg health and vein health.
You're absolutely right. And this is really genetic predisposition. If you've got most of the patients have venous insufficiency, when you really ask them a lot of questions, they tell you that they have some issues. If you understand the whole art of medicine, you realize, that was venous insufficiency. They just didn't know it. We, as human beings, we always try to find some easy answer to our symptoms so we can push it aside and not worry about it. If you get a leg cramp, you think it's because I'm dehydrated, or I don't have enough magnesium, or I don't have enough potassium. You never try to say, well, what if I'm wrong? Maybe I should go and have myself checked. And I think one of the commonest reasons for cramps, especially at night, which wakes you up and you have to walk it off, is venous insufficiency. You don't get dehydrated till 2 o'clock in the morning. And you don't become magnesium deficient or potassium deficient or sodium deficient. If you have a healthy diet, and Lord knows, America, we are so careful about making sure everything is fortified with minerals and vitamins. So there is almost no reason for you to become magnesium deficient or potassium deficient. So just to say this is probably what's going on, if I have enough electrolytes, I'll be fine, is not the answer. So I think to your point, I think the health awareness is so important. And you and I had discussed this before. Venous insufficiency right now, to the best of my knowledge, is still, if you Google it, you find out it is probably the most, if not one of the most commonly undiagnosed or underdiagnosed condition in Earth, on the face of the Earth, which is which is sad. You got something which affects up to 40% of the population, and yet 0% of the doctors seem to know that it is a disease and it needs to be addressed and it is preventable and it is at least easily treatable if it was diagnosed. To me, I like to talk about venous insufficiency a little bit like you have a dam which has got some crack in it, and eventually the dam breaks and hell breaks loose. And it is a valve issue. Once that last valve in your vein gives up, you get sudden swelling, and then it's a scary situation. Thank God it's very easily treatable, is very easy to maintain. Hopefully, this will allow the world to realize there is such thing as venous insufficiency, because people look at the leg. If you didn't have varicose veins, you did not have venous insufficiency, which was wrong. So this is one of the reasons why we are doing this podcast, is to make people aware of health issues, the things which are brewing in the background. They say an ounce of prevention is better than a ton of cure. As long as you know there's some health issues which are about to evolve and hurt you, my job as a physician is try to dig as hard as I can and find all these potential issues and bring it to our audience and let them know these potential issues exist and how can you do to diagnose it, what can you do to prevent it from getting worse, what can you do to treat it if it does develop. And this is, I think, the main reason why we like this new podcast to evolve. And that's the reason why you and I are switching the name from Nice Living to Nice Legs by Dr. Kamran, which would be really concentrating almost solely on leg health. We are on YouTube. We have our own Facebook and Instagram. We talk about veins all the time. And I'd like our audience to know this particular episode, this is what we are doing here, Nice Legs by Dr. Kamran, is going to be everything about the leg health and probably very little about venous insufficiency, but about all the other issues associated with vein health. I think maybe our first one or two episodes will probably bring some of our patients who were either nurses or they were runners or joggers, so they could explain to us how did they realize that what they were suffering was venous insufficiency, and then how did they help maintain it and have it treated, and what kind of results did they get. Since that's my expertise, I think it's very easy for me to discuss that. Then going forward, I like to reassure and assure our audience that I'm not going to be talking about veins every day. It's going to be about all the other issues. For example, lipedema is a very interesting situation. We didn't even know it existed. So if you have a lot of fat inside of your thigh or around your ankles, it doesn't mean you're getting fat in your ankles. It's lipedema. It's just fat deposited in the wrong area. How do you treat it? How do you take care of it? Who do you go to? And there are some plastic surgeons who are very available to take care of it. A lot of plastic surgeons are not quite familiar with it. So hopefully we can bring some experts on the subject who could come and talk to our patients about that. So these are the issues, I like to address, going forward.
Absolutely. Well, again, to our listeners, as Dr. Kamran said, you can follow scarlessveincare.com on Facebook, on Instagram, and he's putting a lot of incredible content out there, specifically leg vein focused. But again, with the new podcast, we're going to be talking leg health overall. We're going to be posting clips on Facebook and Instagram as well. You can find the full podcast online at scarlessveincare.com and on YouTube and on your favorite listening platforms as well. Wherever you listen to your podcast, you'll be able to find Nice Legs with Dr. Kamran. And we want you to be a part of the show too. So if you go to scarlessveincare.com, you can find a spot to submit questions. You can also suggest topics. If it has to do with healthy legs, we want to hear about it. And we want to help connect the dots on information you need to have your best legs. Dr. Kamran, any final thoughts for our listeners today?
I think we are on Amazon or Spotify, and ask Alexa to play our podcast. And I think it's very easily accessible. People might not know that. And we try to keep it short so you don't get too bored.
Well, Dr. Kamran, it's always such a pleasure. Looking forward to the next episode. And to you, our listeners, thanks so much for listening to the Nice Legs with Dr. Kamran podcast. Stay tuned.